I like to tell stories of my day-to-day life. I like to tell stories of lived experiences. So I craft the stories, I post them on LinkedIn.
Nigeria happen to have the highest percentage of sickle cells. Why is Nigeria this prevalence with that?
There's so many factors that drive this. People don't know their genotypes, the lack of access to tests. And so we buy test kits and we go into the fields, we target youth population and we test them free of charge.
Could you tell me a bit about yourself?
My name is George Oche. I currently serve as the general manager for the Rabiolo Foundation. That's a non-profit organization that is dedicated to making impact in sickle cell disease, education, and community development. I also am a sickle cell warrior and sickle cell advocate. I am also a storyteller and researcher.
Yeah, that is a lot.
We try our best.
All right. So, what do you do in your day to day? Now, we know that you're a warrior, which is to start with. That is an important one. Then you also manage an organization.
Yeah.
Can you tell me about what do you focus on mostly on your day to day activity?
Wow. Okay. My day-to-day activity. Basically, it's driving impact. So let me start from I come to the office. So when I have to come to the office, many times I work on projects. So before you embark on a project, you probably have to do your project planning and all of that, right? So we review projects and we sometimes monitor previous projects. Or when I'm out of the office, I volunteer with the foundation I founded. So I teach children living with sickle cell disease. So I take them home lessons just to support them academically, right? So I founded ILAP initiative that supports children living with sickle cell disease in underserved communities, right? So what we do is we don't just support them with healthcare services. We also want to be more holistic. So we do education, we do mentorships, and so almost every day, every weekday, you find me in a child's house, teaching them, helping them with homework, helping them with being their partner and all that. Uh, then on some days, you don't see me in the office, you see me in the field, probably executing a project, right? That's how my life is actually. Then there are those days where I'm at home, there's nothing to do, usually during the weekends, right? Although many weekends are on the field, but the weekends that are not on the field, I craft stories. you know, I like to tell stories of my day-to-day life. I like to tell stories of lived experiences. So I craft the stories, I post them on LinkedIn. Every once in a while, I write just for myself. I mean, things that I don't share. But yes, that's basically my day to.
How are the people receiving the story that you're sharing with them?
I think it's been amazing so far. You know, so I like to say that the stories I share has helped me do quite a lot of things that the common man would probably think impossible. So for someone of my background, it's quite interesting how much funds have been able to raise, how much support have been able to garner, how much access, how much doors have been able to open for the people I support in my community, for my beneficiaries, for the kids, right? I get to meet amazing people that come into my DM and they're like, "Oh, we love what you do. We like how your stories help us connect. How can I support?" And I've met amazing individuals. I've walked into rooms, and sat with people I probably never thought I would sit with. So I would say the stories are going well. They're taking people sort of connect with them, and I'm proud. I'm glad that things like that happen.
Can you tell me a bit about what is your scope? Which area do you mostly operate with? If somebody were to come to Lagos, where would they find you?
Oh wow, you would find me in Yaba. I'm mostly in Yaba. Currently, I am leading a project around sickle cell prevention. So, the Rabiolo Foundation has this project, has this goal of reducing the birth of sickle cell children in Nigeria. So, uh, data has it that Nigeria has the highest burden of sickle cell births. And now, clearly, it's as a result, it's there are so many factors that drive this. People don't know their genotypes, lack of access to tests, and so we have this. We buy test kits and we go into the fields. We target youth population and we test them free of charge just so they can know their genotype and make better informed decisions. So when we test them, we also tell them what genotype is all about because, and trust me, it's fascinating how much people don't know about genotype. So many people think genotype is blood group, and then many people think blood group is genotype. So the education part is important. That's one project we are working on currently. It's been fascinating and interesting. I find it very interesting. Um, Another project I would say I'm working on, it's in collaboration with this doctor. He's doing a research to study the effects of art therapy among children with sickle cell disease and how it contributes to their well-being. And I find that also interesting, among other. I mean, there's other projects, but I think these two for now are the ones I currently find interesting.
Let's say we have somebody in front of you now who is making this confusion between genotype and blood group. Where do you start from? What do you tell this individual?
Okay, I think it will depend on the audience. So when I'm in front of teenagers, in schools mostly, when I'm in front of teenagers, I start with a very simple illustration. I like to bring out a male student and a female student. And I'm like, so this one has something called AS, this one has something called AS, right? And then I like to tell them, okay, genotype, first of all, is like your genetic makeup. But when it comes to your blood, when it comes to blood genotype, they are different that can affect your health, that can affect the health of your children. And then we try to do a compatibility thing. So for the students, there's a male student and a female student. And then we pair them up and we're like, so this one has AS, this one has AS. If they come together and get married, the child can pick A from here, and the child can pick A from here, and that will be AA. But also, there's a possibility that the child can pick A from here and pick AS from here, that's AS. But more importantly, there's a possibility that the child can pick S from the mother and S from the father, and that would be SS. And because this thing happens randomly, you just don't know if which the child will pick. That makes that possibility of SS coming into the picture a very big problem. And so that tells you this couple is not compatible. So that's the simplest way we break it down to teenagers. For adults, we do something similar, but it also depends on, are you in front of adults that are very well educated or adults that are not too educated, right? So I would say it depends on the audience. If they're educated, it's as simple as, using the major, oh, genotype is all about your genetic makeup, and for blood genotype, you have so so and so. If you want to get married, you need to go and do your HPLC test and all of that, all of that. And just the basic talk. Mostly there is no need for illustrations because sometimes they get the point, right? So yeah, for me it depends on the audience, just to make sure they know or they understand what you're saying.
Thank you for that. And you did also share that Nigeria happened to have the highest percentage of as sickle cells. Can you tell us more about that? How did you come with that data, and why is Nigeria this prevalence with that?
Oh, okay. How did I come up with that data? Well, I would say I came up with that data. It's based on so many research, right? So many research has proven that. So globally, you have about 300,000 births of sickle cell disease, but Nigeria alone accounts for 150,000 thereabouts. Um, mind you, research also shows that because of the demographic or the geographic area of the black people, so to say, it's more driven among black. Now, that doesn't mean that other populations don't have or cannot have sickle cell disease, but it's just more driven among the black. So some people, you hear some people say, oh, it's a black man disease. It's not quite a black man disease, it's just that it's more common. Then, for the question of why is it very much, why is the prevalence much in Nigeria? So, first of all, if you really want to go to the origin, we can blame geography because there is this theory that says that it's our gene, when our genetics is trying to adapt to high malaria prevalence. So how do I break it down for you? Okay. Now, normal red blood cells are circle, they're round. And when you have a malaria parasite, your round blood cells are very good place for them to grow. And so with time, our body started to adjust, and so the body sort of tried to mutate the red blood cells to become sickle, right? And just so that it can fight off this malaria parasite. That's why you hear many people say, oh, people that have AS and people that have SS don't really catch malaria fast. They do, but it's not that easy compared to people that have AA. So if you want to go back to the past, you would say it's a matter of geography. The place we are, the tropics, it has high malaria prevalence, and then our body adjusted. But you see, the problem with that was with this adjustment came the issue of people having AS, and then males having AS and females having AS come together, and then they give birth to children with SS, right? So that's one reason. Another reason should be education. A doctor once told me that sometimes some problems will not really be solved easily because they are just like cultural. We are in that part of the world where people get married. We believe in procreation. You have a couple, they have up to 6, 7 children, right? That's a higher chance, especially of giving birth to children with sickle cell disease, especially if these couples don't even know their genotype. So imagine if a couple have both are AS, or somehow they are not compatible. They give birth to the first, second, the third, the fourth, and then you can have one family having up to like 3 children with sickle cell disease. You know, so we see these things every day. There are a lot of factors that come into play here. Population, high population in Nigeria too, right? So if you go to a country that has just 200 people, and then you come to a country that has 600 people, you should expect more people with sickle cell disease in this country. So I go to schools, right, and I find more children with sickle cell disease in public schools compared to private schools because of the population. So we could go on and on.
So it means now that the sickle cell anemia is related to the body trying to fight off the disease of malaria. Because I was wondering why we actually refer to it as a disease.
Now, it's a genetic, so it becomes a genetic disease because there's a mutation somewhere that causes the body to now produce so much sickled blood cells, right? And so these are abnormal. Remember I said normal red blood cells should be round. And so you have this genetic condition now that makes the body produce too much abnormal red blood cells. That is sickled in shape, so sort of C, you know. Now, it becomes a disease because number one, your normal red blood cells last up to 120 days. So the round ones last up to 120 days, but the sickled ones last probably 20, 20 days, right? So they die off quickly. Well, what that means is oxygen that needs to be taken to different parts of the body becomes a challenge, right? So the red blood cells, the normal healthy red blood cells should take oxygen to different parts of the body. And that when this does not happen. Different organs begin to shut down because they are lacking oxygen. Um, so yes, it becomes a disease because your body is no longer functioning well, right? Then there is the issue of the sickle red blood cells tend to cluster at different vessels. So the round ones are elastic; they move freely through your veins, through your blood vessels. But the sickled ones, imagine two sharp pointed things, and they're just moving, and then they just tangle up somewhere, and they clump. And so children or people living with this disease start having pain because there's a clump there, the blood is not flowing, right? And it's sharp. And so all of these things lead to different complications. And so it's termed a genetic blood disease because it causes dysfunction and complications. And of course, when something causes complications, when it causes dysfunction, when it causes an unhealthy state of the body.